to Nurse Bae. Can you tell me who Nurse Bae is? This video is for all the men and partners, okay? We do not give them the credit that they deserve. So, everyone watching this video, turn to your mate, your spouse, your fiance, your girlfriend, your boyfriend, your husband, whoever it is, and say, thank you, Nurse Bae. I appreciate you. Okay? Please. They do so much. Okay? In most cases, your man, your woman did not ask you to have this surgery. So therefore, they don't know what to expect after your procedures. So let's educate our mates before surgery. Okay? Make sure we educate them. I have so many good men and women who bring their mates with them to the body bar for their post-op care. So I call them my assistants because they are always willing to learn and to assist Nurse T with the care. So, listen, you better hold on to your Nurse Bae. I mean, hold on to Nurse Bae. Okay? So if you got a Nurse Bae, you better hold on to him or her. So, without any prior health care or caregiving experience, this can be traumatic and challenging for your mate. Okay? So be easy on them. Please, please, please be easy on Nurse Bae. Okay? Try to help Nurse Bae. Try to help them prepare for your surgery. Let them watch videos with you. Let them see the YouTube with you. Let them know about your surgeon who you're having the procedure with. Okay? It's very, very important. So, here are a few tips for Nurse Bae. So, go get Nurse Bae right now. Go get him or her, Nurse Bae. I'm going to give you a few minutes. Go get Nurse Bae. Okay, Nurse Bae, you got him? You got him? Okay. So, let Nurse Bae know. First things first. Let Nurse Bae know how you will look after surgery. When you come from surgery, you will not be the same. You will be weak. You may have blood all over you. You'll be in pain or discomfort. You will also have a binder or this good faja on you. It'll be a stage 1, but you'll have a faja on. You may be in a wheelchair. You're probably going to be nauseous from anesthesia. Okay? You may even feel that you may faint. So just be cautious of that. It's not abnormal. So you may feel weak. You may feel like you're going to faint. So just make sure, Nurse Bae, you have a lot of fluids ready. You want to give them fluids through a straw. Maybe some crackers in the car. We use crackers to help coat the stomach. So before you get home to take your meds. Okay, that's very important. Now, second, Nurse Bae, always wash your hands. Universal precautions, okay? We want to wash our hands. We want to wash our hands at least 26 seconds, or you can sing your ABCs, but wash your hands with antibacterial soap and warm water prior to touching your loved one or whoever you're caring for. Wear gloves when you're providing care, especially when you're coming in contact with blood or with any type of fluids. It is important. This decreases the chance of infection. We don't want to spread infection. Next, I want you all to let Nurse Bae know if you have a tummy tuck, you will be walking bent over. Initially, you'll be bent over. You may be hunched over. So be sure you make it clear that that's how you'll look coming out of the surgery room and maybe for the first day or so. Okay? If you're having a breast augmentation or a breast reduction, make sure that Nurse Bae know they can't hug you at that time. You can't lay on your breast. They can't lay on your breast. So you may not be able to move your arms. You may not be able to stretch them out, move them over your head. Okay, they will look different. You may have gauze or bandages or incisions around the breast. They will be tender. They'll be very swollen. Okay, Nurse Bae? So understand this. These are things you will see. Okay, another thing is, sorry, Nurse Bae. I am so sorry about this one, Nurse Bae. Listen, they cannot have sex for a minimum of 2 weeks. Okay, this may vary per your doctor or physician or the surgeon, but let me tell you, they cannot have sex within 2 weeks. It could be longer. If they had a BBL, they cannot have sex on their back or their butt. You got it? If they had a Brazilian butt lift, they can't have sex on their back or their butt at that time. Okay? Next, if you have lipo, Nurse Bae, understand, if that lady or man has lipo, you will see bruising over your body, which may vary depending on your complexion of your skin and how aggressive they were with the lipo. So lighter skin patients may see some blue, some pink or red bruising, whereas people dark skin like me, more darker, they may have purple or red bruising or a darker purple, okay? Nurse Bae, they may feel stiff and tight, which is okay. This is normal. They may not be as mobile as they used to be. So if they're not as mobile, it's okay. Make sure you take them to have their post-op massage or some type of post-op care. Okay? That will help with the swelling, the discomfort, and the stiffness. So that'll help them become more mobile if they come and have post-op care or with somebody like Nurse T. If they come to the body bar, get them here, drive them here so they can get some relief. Okay? Now, we also have to let Nurse Bae know that you may have a drain. One of those drains coming out. If you have a drain with blood and fluid coming out, what it's for and how to care for the drain. Okay, Nurse Bae needs to know how to milk the drain. He needs to know how to look for things in the drain that should not be there. So that's very important. If you don't understand, call Nurse T and I will help you. If you have a BBL and you cannot sit on your buttocks or your sides, be sure they keep you on your BBL pillow. Nurse Bae, every person should have a BBL pillow. So make sure you keep them on their pillow. If you have a tummy tuck, you cannot lay flat on your stomach or you can't lay flat on your back. So Nurse Bae, be sure you have a recliner chair or large pillows to prop them. Okay? You cannot lay flat with a tummy tuck. You don't want to put too much pressure on that incision, okay, in the stomach. And that abdominal wall, we don't want to put a lot of pressure there. Next, Nurse Bae, be sure they wear their compression socks. Very important. That helps with the swelling or edema in the lower legs or extremities, okay? So please note that when putting on compression socks, it is much harder than putting on regular socks. It's very, very important, okay? They don't have to sleep in the compression socks, but wear them during the day, and they should be up and moving around. Now, if the person you're caring for complains of leg pain, this is the most serious one. If the client or the patient or your loved one complains of leg pain and shortness of breath, take them to the doctor or the ER immediately. Do you hear me? If they complain of shortness of breath, leg pain, take them to the doctor or the ER immediately. Stat, quick, fast. That could be signs of a deep vein thrombosis or a blood clot. And once that travels to your lungs, guess what? You die. And it's serious. Okay? We don't need anybody dying from plastic surgery. This is elective surgery. So believe me, this really can happen. And there are people who died from blood clots after plastic surgery. So don't play with this. And I'm serious. So Nurse Bae, take her to the ER, take them to the ER or to their physician right away. Don't even call me. Just take them to the hospital. Nurse Bae, they will have on one of these things called a faja. This is a faja. It fits tight. Or they may have on a binder, okay, which may have some type of blood on it, fluids. In most cases, it's called tumescent fluid from when they have the lipo and it's just coming out. But again, it's actually fluid or blood that you'll see on that garment or that faja. That's called a faja, compression garment. Again, be sure, Nurse Bae knows you will need a lot of water. Do you understand? Water, not Gatorade. I said water, H2O, not Gatorade. Why not Gatorade, guys? Why? Tell me. It's full of sodium, it's full of salt, and that causes swelling. Okay? Be sure Nurse Bae picks up all of your medications before surgery and that all medications are given on time. And what you can do is set alarms on your phone to make sure that you get the medications on time. Another one, let Nurse Bae know you may get constipated. So be sure you have your stool softeners or laxatives. Make sure you have that Colace. Make sure you have that Miralax. Make sure you have apples, high fiber foods, prune juice, okay? Keep those bowels moving. We want them out, Okay? We want to get it out. Next, Nurse Bae. Understand that lady, that man, they may cry. They may be sad. It's something like postpartum almost. So when you see them cry or be sad, understand, be empathetic with them. It's because they weren't expecting their body to look this way or feel this way. Okay? So everybody's recovery is different and it's a long process. Next, let Nurse Bae know you may have wounds, open incisions that may drain. Okay, so that's where the blood and the fluids will be coming out. They may see fluid, they may see blood coming out, which is normal. It's okay, as long as it's not a huge amount. We don't want you to hemorrhage. They can use a gauze. So I have some gauze here. These are 4x4s. You may use gauze to cover it. You may also use a poise pad. So what you do is you'll see these poise pads, and you can use these to actually place over where it's draining. Okay, so Nurse Bae, you can do that. Also, have a thermometer accessible, Nurse Bae, and I want you to make sure you take their temperature daily. Okay, notify Nurse T or your physician if the temp is 100 or higher. If the temperature is 100 or higher, notify Nurse T or notify your physician. Got that? If the temp is 100 or higher, notify Nurse T or your physician. We don't want that. It could be the first sign of infection. Nurse Bae will have to help you take a shower the first time. You may need a shower chair, a shower bench. Use antibacterial soap like Dial or Heba Cleanse. In the bottle is the medical soap cleanse. Use that to clean your body. Next, Nurse Bae, if you have to do the cooking, guess what? I need you to cook healthy recipes, okay? Follow healthy recipes, a healthy diet, not the old diet that they used to with all the fried foods, okay? Or, guess what? You can invest in Nurse T's Secret Formula Post-Op Recipe Book on our website. So if you invest in Nurse T's Post-Op Recipe Book to prepare healthy options, that will help them recover faster, better, and improve their recovery. Eating healthy is very important. That's imperative. Changing those lifestyle habits. So these are just a few things that I teach our Nurse Baes who come to Nurse T's Body Bar. So we support and we appreciate the famous Nurse Baes of Nurse T's Body Bar. So whoop whoop, those are our babies. I appreciate you all. I'm sure your husband, your wife, your boyfriend, girlfriend appreciate you. So if you're taking care of your mate, tell Nurse T, what questions or comments do you have? Always feel free to call Nurse T. Book your consultation. Call us at 248-313-BODY. 248-313-BODY. 2639. And visit us. You can visit us at nurset'sbodybar.com prior to having surgery. Again, visit us at nurset'sbodybar.com. Thank you, Nurse Bae.